So now we want to see how to do an ankle jerk. Before you do any clinical examination, you should have consent from the patient and you should inform the patient about the clinical examination, what you are going to do. We have already informed the patient and we have taken the consent from this patient. Now we are going to do an ankle jerk examination. Whenever you want to do an examination, the area should be exposed. In this case, the gastrocnemius soleus muscle should be it should be exposed because we want to see the ankle reflex which is elicited on this gastrocnemius soleus muscle. Expose the muscle and then make a proper position like this. The muscle should be in semi-stretch position. This should not be totally relaxed. This should not be totally stretched. So this is how we do it. Ask the patient to relax and then you hit your hammer. Now your hammer should have a free fall. It should not be hit like this. And preferably it should be at 90 degrees to the tendon, not at 180 degrees, because if you are hitting at 180 degrees, you may not properly hit the tendon. So what we do is we hit at 90 degrees. And you can see a reflex is elicited. And if the reflex is not elicited, we reinforce the patient. Now, reinforcement can be done by asking the patient to lock the finger and ask the patient to pull the fingers when you are going to hit. Or you can ask the patient to clench the teeth. You only ask the patient to exert when you are going to hit with the hammer. So patient should not keep on forcing the hands throughout the procedure. Only when you are going to hit the hammer, you ask the patient to pull it and then you hit it, or clench the teeth and then you hit it. The root value of ankle jerk is S1. Ankle jerk may be absent, maybe it is present. If it is present, you have to note this is normal or this is brisk. Brisk ankle jerk is seen in patients who got upper motor neuron lesions and sometimes in anxiety is also brisk. In patients with thyrotoxicosis, this can be brisk. It's absent in the lower motor neuron lesions or if the patient has peripheral neuropathy. If the sensory arc is disrupted either in the sensory limb or in the motor limb, the reflex becomes absent. In hypothyroidism, there is a special characteristic feature of this jerk. The relaxation phase is delayed. So there is normal contraction phase and there is delayed relaxation of the ankle jerk. This is called hung up reflex. So this is what we do when we are doing ankle jerk. Thank you.